If your patients already have obesity, if they already have anxiety, if they already have depression, they've got pain, high blood pressure, cognitive decline, these are all your patients. CareGuard will help. And if you're concerned, like you should be, about liabilities, about potential for drug diversion, if you're worried about litigation, if you're worried about issues that maybe your management hasn't told you and you're the ownership group, or maybe the employees haven't told you and you're the management group, and maybe both management and ownership are blind to what's going on because it's in plain sight, but it's hidden because you have really crafty employees. Maybe it's something totally outside and it's the guilt of another party that says, hey, I just feel horribly guilty that so-and-so's in the nursing home, and now I'm going to nitpick at everything and I'm going to find a reason to feel like I've participated. You don't know which of these things it is. So no matter how much money that you end up making, if your expenses go up, you don't have much money. And even after you have those few dollars left and you're trying to improve service and you're trying to help your patients, something else can come bite you in the butt. And those clawbacks can really get you. So that's what we're trying to avoid. We're trying to maximize your revenue by keeping you full. We're trying to differentiate you, and we're trying to minimize your expenses. And we're trying to prevent clawbacks. We're trying to prevent that litigation at the end that can take whatever resources you've made that you're trying to save up and do good with, and it gets destroyed. So CareGuard is about compliance, accountability, risk management, excellence in care, guarding patient safety, upholding ethical standards, assessment, reporting and transparency, and documentation. It's a variant of a patient care organization that we've created that allows you to take care of your patients and have a reporting capacity. What we do is we put an emblem on your website, we put an emblem or emblems at your physical site, and it allows people to QR code in reports. It allows them to report issues that they've noticed. Those reporting methodologies then end up in our portal, and our portal allows us to report to the federal government, the CMS, the AHRQ, and give them the data about quality in particular facilities, but it's anonymized to them. And it also is simultaneously transmitted to the CareGuard legal team that is under your employ, and they decide what needs to happen. So we don't retain inside of CareGuard, the nonprofit, we don't retain any information other than anonymized information. So even if we get a deposition request, even if we get a production request, we don't have anything, and we're protected anyway because we're a patient care organization. And the information that goes to the attorney, that goes to the attorney. The attorney will judiciously figure out what needs to happen, and then they can retain sections of what we need to do, and we interact with them and they interact with ownership. And so it creates a bubble in an area of legal work product that keeps everybody safe. This confidential reporting, it's the attorney-client privilege. And those data reports go directly to the attorney. And so we're using the work product doctrine for investigations. And all of our reporting is non-discoverable because it goes to the attorney. It doesn't come to you directly. It goes through the attorney to us to do investigation on the behalf of the attorney. And then it goes from the attorney to ownership. And then the ownership can decide what portions it wants to share with management. And it can quickly get ahead of potential problems before they go out of control. Like I said, we don't retain a copy of the incident report, so it protects us from being subpoenaed or drawn into legal action. And we're merely a facilitator without involvement in the legal or auditing process. We work on the behalf of the attorney, but that's not in the CareGuard nonprofit. That's in our CareGuard 360, and that's a totally separate program. And that's where we do our compliance measurement. And I'm going to go through that a little bit more so that you have a better idea of the hierarchy and how we've set this up. Our main goal, though, is to focus on prevention and early intervention. We want to get well above everybody else in the community. We want to protect the patient's health. We don't want that patient to get discharged to the hospital because they've got some sort of transmittable illness. And we want to help you grow your ancillary revenue, because without that revenue, you can't stay open. So we've got a whole varieties of ways to help you differentiate yourself from your competitors. Our main goal is to give the ownership group certainty that the actions that they're taking are appropriate. And it's a feedback loop. And it makes sure that the management's doing what they're supposed to. Because typically ownership groups own multiple entities. They own multiple facilities. They can't be everywhere at all times. And if you rely on the 2-year JCO report, that may be a long, long time before you find out something's gone wrong. And if you purely rely on management, and management's the problem, and you can't figure out why, this is a third rail. This is like having extra security cameras everywhere and then having somebody watch them and report it and give you the information safely and not offend management. So we've got a better way. We can really improve the quality of care and we can reduce healthcare expenditure. We definitely can help improve your ancillary revenue. And our fundamental goal is to reduce the discharges to the hospital. We do that because we get ahead of the problems before they occur.